Hey guys, welcome to our channel. Today we'll see what is Gamekeeper's thumb. First we'll see its introduction. Gamekeeper's thumb is an injury to the ulnar collateral ligament of the metacarpophalangeal joint. Ulnar collateral ligament is the ligament on the thumb and it is responsible for providing support to the thumb when we pinch or grip the thing. It helps to keep the thumb stable and prevent it from moving in ways that could cause problem. And the metacarpophalangeal joint is the joint where the thumb connects to the hand. The second point is this is a strong ligament that supports the thumb when pinching or gripping, and if it is damaged may lead to chronic instability of the thumb which causes problem with function. It means if the ulnar collateral ligament gets injured or damaged, it can lead to a chronic instability of thumb. Or in other words, we can say that the thumb may become shaky and it can affect how well we can use our thumb for everyday activities. For example, you may experience pain and weakness when trying to pinch or grip objects. The next point is the stability of thumb on the ulnar side is maintained by four structures. Thumb is an important part of the hand that allows us to perform a wide range of tasks, from picking up small objects to gripping and manipulating larger items. In order to do all of the things, the thumb needs to be stable and well supported. There are four structures that work together to maintain the stability of thumb on the ulnar side. And ulnar side is the side of hand that faces the little finger. And these structures are: first is adductor aponeurosis, second one is adductor pollicis muscle, third is ulnar collateral ligament, and the fourth one is volar plate. One by one we'll see how they play role in stability of thumb. First we'll see adductor aponeurosis. Adductor aponeurosis is a strong band of tissue that runs from the base of thumb to the wrist. It helps to hold the thumb in place and prevent it from moving too much towards the other finger. The second one we'll see adductor pollicis muscle. This is a muscle that lies deep within the hand, near the base of thumb. It helps to pull the thumb towards the palm of hand. It plays a role in keeping the thumb stable on the ulnar side. The third one we'll see the ulnar collateral ligament. This is a thick band of tissue that runs along the inside of thumb, connecting it to the wrist. It helps to prevent the thumb from bending too far to the side, which could cause it to become unstable. The next we'll see volar plate. Volar plate is a thick fibrous tissue that lies beneath the skin on the palm side of thumb. It helps to cushion the joint at the base and provide stability by preventing hyperextension of thumb. Hyperextension of thumb means overbending of thumb. Next we'll see the etiology of gamekeeper's thumb. In this we'll see what are the factors that are responsible for the cause of gamekeeper's thumb. The first is the injury happens when falling onto the outstretched thumb and is more likely if the thumb is gripping something at the same time. It means it is a type of injury that can happen when someone falls and lands on their hand, specifically on their outstretched thumb. It is more likely to happen if the thumb is gripping onto something at the same time. The next is falling while skiing while holding a ski pole is a common cause, hence the name frequently given to this injury. That's why the gamekeeper's thumb is known as skier's thumb. Skier's thumb gets its name from the fact that it is a common injury among skiers. When someone falls while skiing, that person is holding onto their ski poles, which can increase the risk of falling and injuring their thumb. Next we'll see the symptoms of gamekeeper's thumb. When someone experiences a thumb injury, specifically a valgus injury, there are certain symptoms that they may notice, and these symptoms are: first is the thumb will be swollen, bruised and painful. Following a valgus injury to the thumb, the affected thumb will often become swollen. Swelling occurs when there is accumulation of fluid in the tissues. In addition to the swelling, There may also be a bruising which appears as discoloration of the skin, and that discoloration of the skin occurs due to blood leaking from the damaged blood vessels. And also, the thumb is likely to be painful, causing discomfort or aching sensations. The next symptom is valgus injury to the thumb. Valgus injury refers to the specific type of injury where the thumb is forced away from the hand midline in the direction opposite to the other finger. It typically occurs when the thumb is bent backward or away from the palm, leading to stress on the other structures supporting the thumb joint. The next symptom is frequent ecchymosis at the ulnar aspect of thumb metacarpophalangeal joint. Ecchymosis refers to the appearances of bruises or discoloration of the skin. In case of valgus injury to the thumb, ecchymosis is often observed on the ulnar aspect of metacarpophalangeal joint. Next, we'll see the diagnosis of gamekeeper's thumb. For evaluating, there are certain examination techniques that can be used. First is palpation may reveal a lump indicating a Steiner lesion or avulsion fracture. Palpation refers to the process of using touch to feel and examine a specific area of the body. In case of thumb injury, palpation can be done to assess the affected area. During palpation, a healthcare professional may feel for any lumps or abnormalities in the thumb. If a lump is indicated, it could indicate a specific type of injury called Steiner lesion or an avulsion fracture. Here we have seen two new terms, that is Steiner lesion and avulsion fracture. First we will see what is Steiner lesion. Steiner lesion is a condition where the torn ligament of the thumb becomes trapped and displaced by another structure called adductor aponeurosis. If a lump is palpated and suspected to be a Steiner lesion, it usually requires surgical intervention for the proper treatment. The next term that we have to see is avulsion fracture. An avulsion fracture occurs when a piece of bone is pulled away from the main bone due to a forceful detachment of a ligament or tendon. If a lump is palpated and suspected to be an avulsion fracture, it may require further investigation and management, such as immobilization or surgery. Next is plain radiographs and valgus stress testing radiographs. Plain radiographs are also known as X-rays. X-rays are taken to visualize the bone of the thumb and detect any fracture or other abnormalities. Valgus stress testing radiograph is a specific examination technique used to assess the stability of thumb joint. During this test, a healthcare professional applies a sideways force to the thumb, at the same time observing and possibly taking radiographs. Valgus stress testing radiograph can help determine the extent of ligamentous damage and joint stability in the thumb. The next is valgus stress testing is done with the metacarpophalangeal joint of the thumb in the 30 degree of flexion. We'll do the test of valgus stress testing in the position when the thumb is in 30 degree of flexion. Next is 30 to 35 degree of radial deviation of the thumb indicates a complete ulnar collateral ligament rupture. It means when the thumb is radially deviated of about 30 to 35 degree, that indicate a complete ulnar collateral ligament rupture. The next is avulsion of ulnar collateral ligament of the thumb, that also indicate that a person has a gamekeeper's thumb. Next we will see the treatment. We see the treatment of gamekeeper's thumb in a condition when the thumb is stable on valgus stressing. It means that the person has no Steiner lesion. Now, when we say a stable thumb on valgus stressing, it means that the thumb remains stable and doesn't show any signs of excessive movement or instability when subjected to a valgus stress. This is a positive finding and indicates that the ulnar collateral ligament is intact and functioning properly. In this, the first treatment is healing will occur with non-operative treatment. Healing can occur without the use of surgery. It can be treated using the methods that don't involve any surgery, such as medication, physical therapy, or other types of therapy. The next is thumb is immobilized for 4 weeks in a short arm spica cast, usually with the thumb IP joint free. This type of cast is designed to immobilize the thumb and wrist while still allowing some movement at the tip of thumb. This is important because it helps prevent stiffness and allows the thumb to move freely after the cast is removed. In this cast, the thumb is held still for a period of about 4 weeks. The next is active and passive thumb motion is begin at about 3 to 4 weeks, but valgus is avoided. After approximately 3 to 4 weeks following injury involving the thumb, it is the time to start moving the thumb actively and passively. While performing the thumb movement, it is important to avoid any sideways or outward movements, as it could stress or strain the thumb in an unfavorable way. The next is the splint is removed several times a day for active range of motion exercises. A splint is a supportive device that is typically worn on the thumb to provide stability and protection during the healing process. Splint should be taken off multiple times a day to allow for active range of motion exercises. By removing the splint, you can perform these exercises more freely and without any restriction imposed by the splint. Next is grip strengthening exercises are begin at 6 weeks after injury. Strengthening exercises are designed to gradually increase the strength of your hand muscles and improve the grip. These may involve squeezing special hand grips, performing specific movements with your finger and thumb. Next condition is unstable thumb on valgus stressing. When we talk about an unstable thumb on valgus stressing, here we are referring to a situation when the thumb becomes less stable and more prone to moving or bending excessively towards the outside of hand. This can happen when the thumb is subjected to a valgus stress, which means a force or pressure that pushes it away from the other finger by more than 30 degrees. That condition requires direct operative repair with suture anchor. After 3 weeks following operative repair, following things we have to do. First is remove bulky dressing. After the operative repair, a bulky dressing may have been applied to protect the affected area. To promote healing and allow for proper evaluation, the bulky dressing needs to be carefully removed. The second is removing MCP joint pin, that is K-wire. In some cases, a metacarpophalangeal joint pin, that is also known as a K-wire, may have been inserted to stabilize the joint during the operative repair. Once the healing process has progressed sufficiently, the healthcare professional will remove the pin. The next is fitting the wrist and thumb static splint. After the operative repair, it is important to provide support and stability to the affected area. One way to achieve this is by using a wrist and thumb static splint. This splint is designed to immobilize the wrist and thumb and allowing them to heal properly. The wrist and thumb static splint is intended to be worn continuously. The continual wear of the splint helps to maintain proper alignment, reduce stress on the repaired area, and support the healing process. Next, we'll see what after 6 weeks we have to do. Begin active and gentle passive range of motion exercises of the thumb for 10 minutes each hour. It is important to perform these exercises for 10 minutes every hour. This regular practice helps to maintain and improve the mobility of your thumb joint. Next is avoid any lateral stress to the MCP joint of the thumb. Here, the lateral stress refers to any sideways or sideward force that can strain the joint. It is crucial to avoid putting any excessive pressure or stress on this joint as it can lead to pain or damage. So be mindful of your thumb position and avoid any movements or activities that can cause lateral stress to the metacarpophalangeal joint. Next is begin dynamic splinting if necessary to increase the passive joint range of motion. This technique can help gradually stretch and improve the flexibility of your thumb joint, enabling it to move freely. Now we'll see what we have to do after 8 weeks. The first is discontinue splinting. Discontinue splinting means gradually reducing or stopping the use of splint over time. The main goal of discontinuing splinting is to promote the gradual return of normal movement, strength, and function to the wrist and thumb. Next is a small wrist and thumb static splint may be useful during sports related activities. By wearing a wrist and thumb static splint during sports, you can help protect these areas from excessive strain and minimize the risk of injury. The splint restricts certain movements such as bending or twisting that could potentially cause harm. It also helps maintain proper alignment and positioning of the wrist and thumb, which is crucial for optimal performance and injury prevention. The next is what we have to do after 12 weeks. Allow the patient to return to unrestricted activity. This means that the patient can resume their regular physical activities without any specific limitations or restrictions. Thank you for watching. Do like and share the video with your friends and batchmates. And subscribe the channel. If you have any query or doubt, you can ask me in the comment section. Thank you so much. Adductor aponeurosis is a strong band of tissue that run from the base of thumb to the wrist.